Welcome to our project overview for improving identification of depression and alcohol use disorder in primary care. My name is Kim Johnson, and I'm going to be your host walking you through today's presentation. My colleague Chris Becker and I will be your MEDSTAR representatives throughout the duration of this project. We're so excited to have you join us, and we look forward to having you participate with us in the project. Today's presentation is meant to provide you a high-level overview of the project details. We'll start with a brief introduction to our organization, MEDSTAR, then expectations for the project, a review of the initial assessment, which we do ask you to complete before the scheduled welcome kickoff meeting, technical assistance, and next steps. MEDSTAR is the Healthcare Quality Improvement Organization for Wisconsin. MEDSTAR has been around for a number of years, serving the healthcare community in several different facets. For this particular project, we're partnered with our fellow healthcare quality improvement organizations in Michigan and Minnesota to create the Lake Superior Quality Innovation Network. As a region, we work on a variety of projects funded by the Center for Medicare and Medicaid Innovation. We provide services funded by state and federal contracts, ranging from quality reporting needs such as physician quality reporting, meaningful use support, diabetes education, and infection control, just to name a few. It's important to note that additionally with this behavioral health integration project, we're also partnering with inpatient psychiatric facilities to decrease readmissions and increase outpatient follow-up post-discharge. So your organization may also be working with us on that component of the project, depending on the makeup of your organization. In addition to these funding sources, MEDSTAR also provides services for managed care review, HEDIS audits, meaningful use consulting, continuing education, and more. As we get into the project details, let me start again by thanking you for your participation. We believe that this project represents a huge need for Wisconsin and the country at large, and we're really excited to have you join our community. Our overall goals are to increase screening for depression and alcohol use disorder incrementally from January 2016 through July 2019. With each year of participation, we want to improve screening by 25% for depression screening and for alcohol use disorder screening. CMS is going to evaluate us based specifically on increased screening rates for Medicare beneficiaries. However, all of the technical assistance that Chris and I provide you can be spread across all patient populations and payer mixes. So let's take a look at the baseline and the year evaluation periods. Starting with July 1st, 2014 through June 30th, 2015, we collect our baseline data. Then we'll move into year one, which starts January 1st, 2016 and goes to December 31st, 2016. Here we're looking to have 25% screening rates across all of our constituents by the end of the year. For year two in 2017, by the end of 2017, we're looking to have 50% screening rates. For the third and final year for evaluation, at the end of year 2018, we're looking to have 75% screening rates. Then we have a final half-year period from January 2019 through July 2019, where we'll transition to sustainability with you and also potentially prepare you for future behavioral health integration projects if available. So as an example, let's break this down if we're working with an organization that has 10 clinics. Now, I'm not necessarily expecting that at the end of year 2016, each one of those clinics is actually doing the depression screening. You may want to trial this out first with a few clinics. So let's say that in 2016, we start with a pilot of 3 clinic sites. 7 clinics are not doing the screening yet. At the end of 2016, those 3 pilot sites are successful and are screening 100% of their Medicare beneficiaries. The 7 other clinics are still at a 0% screening. Overall, though, we're at 30% screening rate for the organization, and we are meeting our evaluation measure. For 2017, to get to a 50% screening rate, maybe we add in another 2 or 3 clinics to do the screenings. So then by the end of 2017, we have 5 clinics that are screening for depression and alcohol use disorder, and we have 5 clinics that are not screening yet. Overall, For all of our constituents participating, we're at a 50% screening rate. For the third year, we want to get to 75% screening rate. Maybe we're ready to have the other 5 clinics now hop on board and begin screening for both depression and alcohol use disorder screening. If we get those 5 clinics now screening, we have 10 clinics that are screening. But maybe we're not perfect with it, so ultimately we get to a total of 75% screening rates. Or maybe all 10 clinics are screening every Medicare beneficiary on an annual basis, and we get to 100% screening rate by the end of 2018. It's probably a best-case scenario and maybe not the most realistic. And in 2019, the clinics continue improving upon their screening and will transition to sustainability. Now, the real question you may be asking is, how are we actually going to help each participant increase screening rates? Well, Chris and I are going to take an individualized approach to technical assistance for each organization, and the assessment is going to help us calculate that approach. However, here's a high-level list of things that we expect us to provide and things we expect you to provide as the participant. On the MEDSTAR side of things, we'll provide technical assistance. This will include incorporating the screening tools into clinical workflows, providing coding and reimbursement education, brief intervention and motivational interviewing education, and a variety of other things. We'll also facilitate a learning and action network. This will include community sharing calls, webinars, and potentially in-person meetings as well. We also have access to a Part B Medicare claims database. So we will analyze from this database and provide you reports on how you're trending. We also have the option to look at additional reports beyond that too, if you want us to. And I think maybe one of the most important things that we can offer is soliciting feedback from all of our constituents in the project and making sure we send it back to CMS and help guide CMS on how to navigate this rather new arena of behavioral health integration. On the participant side of things, we'll need you to identify a project point person, or potentially a few project point people if you're a large enough organization. We'll expect you to engage with MEDSTAR and our other participants and truly receive our technical assistance and help us make sure it's the most tailored and how involved you want it to be. We will hopefully have you participate in our LAN events, our Learning in Action Network webinars. And if you want to, you could even provide us additional data, but that's certainly not required. To help us get started with understanding your current level of behavioral health integration, we ask you to participate in an initial assessment. This assessment will be extremely useful for us to determine the technical assistance approach for your organization. For instance, if you already perform depression screening but you don't receive reimbursement for the screening, our focus may first be on training your coding and billing staff. Or, if you don't do any screening, then our approach may first be on publishing the screening tools into your EHR. After we receive your assessment results, we'll analyze the results and compare them to other assessments we've also received from participants. This is to help us get an overall sense of where organizations in Wisconsin are currently at when it comes to behavioral health screenings in primary care. If there are other organizations in your community that have similar needs as you, it may present an opportunity for networking, best practice sharing, and together finding solutions to similar challenges. Ultimately, we'll compile your answers and our findings into an organization profile, and we'll review that profile with you during the welcome meeting. So to allow us enough time to assemble a profile, we ask that you please complete the online assessment at least 2 days prior to your scheduled welcome meeting. The most important thing to keep in mind for the assessment is that we're asking you to answer to the best of your current ability. If you don't have all of the data to answer the questions, try answering based on your gut feel. Also, if you really are unsure about an answer, it is completely acceptable to answer as unsure. We encourage you to ask around your organization and ask other staff to find the answers, but we don't want this to be a cumbersome or long process for you. It's really just meant to give us a snapshot of your current state, just to help us align our technical assistance appropriately. If you do have any questions, please do not hesitate to email me. I'm going to be very happy to answer all of your questions and even help you fill out the assessment. As I stated previously, the assessment helps us prepare a technical assistance for your organization and other organizations that may have similar needs. Our technical assistance may include determining your organization's key stakeholders, workflow mapping, EHR configuration, training, tracking issues and challenges, and trialing different plan, do, study, act cycles to incorporate the screenings into your practice. If your organization is part of the Wisconsin Collaborative for Healthcare Quality, then we're also offering assistance for the new depression screening reporting, which is expected to begin in late spring 2016. For your next steps, please complete the assessment before your welcome meeting. In preparation for the welcome meeting, please send me your point person contact information, especially if it's somebody who Chris and I have not already been in contact. Also, please send me some available time options for the welcome meeting, and if you do happen to have any workflows documented on your behavioral health screenings, you can pass those along too. However, that's purely optional and not expected. Thank you so much for watching this webinar. We look forward to working with you soon and developing our project plan for your organization. If you have any questions, please don't hesitate to email me. Thank you and have a great day.